My name is Kieran and I had a heart transplant in July 2009. I was born with a heart condition called transposition of the great arteries. I had quite a normal childhood when I think about it. I have a twin brother and I was always trying to keep up with him. He was my benchmark. Then one day after school when I was 13, I went upstairs to start an English essay for my homework, and I started feeling a really large pain down my right side, and it transferred to my chest. I got taken to the hospital and it turned out I'd had a heart attack. I knew everything was going to change after that. In my early 20s, I started to get funny rhythms in my heart, and every now and then it'd feel as though it stopped and then give a big thud, which was quite scary. Eventually the rhythms got to being very, very dangerous. At the age of 35, I was told I was in end-stage heart failure. They decided that transplantation would be the only option left for me. Once the transplant was mentioned, I knew that I wanted to donate my heart to the Brompton for research. It was my 7th heart birthday, July just gone, and I'm not entirely sure why, but I did start to wonder about my old heart. So I got in touch with Sonia, and she told me that they'd been doing research on it all that time, and I was amazed. And so I asked, well, could I come in and see my heart?
My specialist field of interest is in the care of adults who are born with their heart defect. We call that adult congenital heart disease. And today I was delighted to be part of the team that were able to show Kieran his own heart. A number of years ago, Kieran participated in research I was doing to see if we could use cardiovascular MRI imaging to determine how much scarring there is in the heart in congenital heart disease patients. Scars could be quite important because these patients can get life-threatening heart rhythm disturbances. Doctors call that arrhythmia. If we want to prevent or treat life-threatening heart rhythm disturbances, we need better ways to understand which patient is at risk. Kieran's donation of his old heart to the Royal Brompton Hospital was extremely important for the research in heart fibrosis imaging. We were able to look at his original scan that I did and the heart directly and show that the imaging that we were doing is highly accurate.
When they brought it into the room, I froze. I had goosebumps. I think for about an hour I was lost for words, and I kept looking at it. I didn't realise that my old heart was being cared for all this time. I was looking after this heart, and my old heart was being cared for by the research team. And then a sort of sadness came over me as to how ill I'd become, which I'd kind of forgotten about because I'd been so well over the last 7 years. Actually seeing my heart there brought back some sad memories. But now knowing it's been part of British Heart Foundation research project and that an awful lot of good is going to come out of that, well, makes me feel superb.
To find out more about British Heart Foundation funded research, visit www.bhf.org.uk/research.